We are live. Hello, everybody. Welcome, welcome. We are here today with Henning. We are so excited to have her on Airway Circle. I'm going to first introduce our topic. We're going to do a little bit different today. And then I'm going to let Autumn introduce herself. I feel like she's going to do a better job than I can. So today we're going to talk about the impact of tethered oral tissue, so tongue ties, oral ties, on breastfeeding. Autumn, thank you for being here. Would you introduce yourself to the public?
Hey, everybody. Thank you so much for having me. I'm excited to be here on Airway Circle. And, this is such a great platform that brings together a lot of different professionals. But for those that don't know me, I'm Autumn Henning. I started out as a speech language pathologist and really found my love in feeding therapy. And you really can't do feeding therapy, and once you see tongue ties, that leads you on. And so I also became a certified orofacial myologist and international board certified lactation consultant. So really that oral function from birth to death is kind of my jam, and that's what I specialize in all day, every day. Let's see, I launched a course a few years ago called Touch Training, Tethered Oral Tissue Specialty Training. And so we've had over 2,000 professionals, dentists, hygienists, speech pathologists, occupational therapists, chiropractors, ENTs, physicians, all run through our course. And so it's really exciting and fun to bring those communities together, similar to events like this. So today we're specifically talking about ties and breastfeeding and how they really impact. And, I think this is something that's near and dear to my heart because I'm a mom and I breastfed and we had trouble. And, a lot of people get into this space and look back and they're like, man, I wish I knew that when my kid was little. Well, I was blessed and I knew a good bit about this stuff when my daughter was born. So we did walk that road, but I can only imagine if I hadn't known some of these things, how to get help and where to get help is something that we see a lot of moms navigating and going to multiple professionals to really address the issues. So that's kind of me in a nutshell. I own a private practice in Greenville, South Carolina, so not too far from Renata, stayed over or so. But yeah, it's really rewarding work and a lot of fun. And so today, I want to dive right in and just, talk about the impact on breastfeeding. So, yeah. And Renata, I know you breastfed too, and did your munchkins have issues?
Definitely, both of them. So Zoe is 6 and Benny is 16 months. When I had Zoe, I did not know anything. But I have always been a huge breastfeeding advocate, coming from Brazil over there, don't really talk about formula, at least when I was growing up. Most people breastfeed over there. And so it was huge for me to be able to do it. I had so much pain. I cried more than she did for 12 weeks straight.
Oh, yeah.
But I have breast implants. She had a lip tie and a tongue tie, all undiagnosed. Zoe would, 3 times it happened as a newborn that she would choke on the milk. It would come out through her nose. She would stop breathing. And thank goodness that part, my hygiene area, I was able to put her upside down and, suction and her nose and everything and get her to start breathing again. So it was super scary and it was super difficult. I don't know how I went through it. And then it was time to have Benny. And I'm like, I got this. This is easy now. And I always say this, as soon as they pulled him out of my belly, I looked at his tongue before I looked at his pee-pee to make sure it was a boy. Like, yeah, I'm died.
That's
and then
hilarious.
and
That's so
then thank goodness I already had people, waiting. I mean, hours after he was born, an ENT came and clipped his tongue, but it was just an interior portion. And of course, I'm calling Dr. Rao, in South Carolina. I'm like, oh my gosh, help me.
yeah.
The second that Benny latched on both sides, whenever he first latched, he cut me on both sides immediately. So I knew that I was going to have an issue. I knew I was not going to be able to do this for 24 hours. And then the same thing, I had so much pain to the point that PPD kicked in, that I all of a sudden stopped making milk. I couldn't get him close to me. Every time it was time for him to eat, I couldn't try to latch him because I knew the pain was going to be excruciating. And it is the worst. I haven't had a normal childbirth, but it is the worst pain I have ever felt in my whole life. Thank goodness. We did at least clip his tongue a little bit, and I had an amazing IBCLC that came here to my house, and she helped me with positioning and everything. But nobody caught the lip tie, and not even me. I mean, looking at it didn't look bad, and
Right.
as it started growing, I was like, oh my gosh, that's such a bad lip tie. I cannot believe that we didn't think it was that bad. And he fell the other day. I'm such a myofunctional therapy mom. He fell and he started crying, and I saw blood. I was like, please be the lip tie. Please be the lip tie. Blood everywhere. And I looked, and yes, I mean, it released, but it didn't release the whole thing. It's horrible. You do not want your child to fall to release a lip tie, okay? It just happened that he did. But
Right.
I'll push him again next time. I'm just kidding. But anyways, we are still going on at 16 months, and he actually bit me really hard the other day because he's teething, and I'm having the same issue again, the same pain from the beginning, and it's not healing, and I don't know what to do. Oh my goodness, it is difficult being a breastfeeding mom with a baby with oral ties and all these issues. So you also had personal experience.
Yeah. So, I think just talking about this, it sounds like it was very different with your two kids. The first one weren't really aware of all of these things, and then your second one you were, and how those journeys were very different. And I don't know who all is listening, if there's parents and professionals alike listening, but I think one of the biggest issues out there is just education on what normal breastfeeding is, and how that's like the biological norm. And I think a lot of moms are very much dismissed, and, well, it's supposed to hurt, well, they have a strong suck, or, well, you can pump, well, there's bottle feeding. All of those things are just like sweeping the actual issue under the rug. And I think our society in general is a Band-Aid society, and let's just address the symptoms and not really look for the reason. And so, those things can get us by for a little bit and buy us some time while we're preparing for a tongue or lip tie release, or maybe both. But yeah, I did have some personal experience, and I do this for a living. This is my profession. But I had a lot of complications with birth, and hemorrhaging, and a lot of things. And and just in general, birth is kind of like a transformative experience, and a whirlwind, and a shock to your body, mind, and soul. um but yeah, I just remember she did latch the first time, and everything was good right off the bat. But as she needed more milk, and wasn't really able to transfer and stay on, that was a problem. And I just remember lactation helping me. I wasn't a lactation consultant at that time. I did treat babies that were breastfeeding, but the mom side of thing is a whole new, not new, but a different piece of the puzzle.
It is
And
totally
that's
like
really unique.
what you're gonna do until you're in that situation, because like you said, birth is so it's a, I'm going to say traumatic, but it doesn't necessarily mean always bad. It is a transformation, like you were saying.
Mm-hmm.
And you are in a totally different state as a mom right after you had your child. And even though you know all these things, whenever you're in it, a lot of times you still need professional help. So,
Absolutely.
my goodness, contacting my IBCLC friend over here, she is fantastic. Helen is her name. And it was crazy because she would come and she would position him in a way and he would latch and I would look at him and I was like, how did you do that? Like, how did you,
Yeah.
it's not hurting. How did you do that? Can you just live with me?
Yes, yes.
No.
Well, and that's how I felt. Like, I mean, I do this for my work, and I mean, I thankfully I didn't have pain, but I just remember crying and being like, I don't know what I'm doing, and just having a lactation consultant there and like there to like cheer you on, support you, like that emotional and that counseling side of things is so helpful too. Um, and just like, yeah, it's a whirlwind and everything's just kind of a blur. And so having someone really be able to think in the moment. I could not put my professional brain on for my daughter at that time. And so, and you know what? You shouldn't have to. You just need to be the mom. So any professionals out there listening, I really highly recommend that you knock on doors for a lactation consultant well versed in ties. So yeah, little McKenna, my daughter, she wasn't gaining weight very well, so we had to bottle feed pretty immediately. I had plenty of milk and things were good on my end, but she just couldn't stay on because that little tongue wouldn't lift and stay cupped. And so she would do this whole little, I call it bobbing for apples, the whole little, like just trying to like get some stability and get on there. And so we did some craniosacral therapy. Obviously, first rule of thumb is feed the baby. Um, and I did try latching to kind of like maintain that breast focus and contact. But it was not happening and she was getting really frustrated. And so, we got her back to birth weight and did some craniosacral. My lactation consultant, my best friend, she's also my best friend now. So that was great. She came and helped me and two, I think considering the type of birth a mom has too, I mean, just what complications there are plays into timing of things. But McKenna was released by our colleague and friend, Dr. Ann Bynum, which I teach a course with her now, and we've kind of really developed our protocols together. But yeah, she was 2 weeks old and we nursed right after and she didn't look back. So obviously I was working, so when I went back to work, I pumped and bottle fed, but I was also traveling. And I left her in her first year, I left her 45 days with all my travels. And so pumping on in airports and in planes and hotel rooms and you know teaching a course and then going on the breaks and going
Wow.
to pump and transporting milk through TSA and all of those things. So, it can be done, but I totally credit it to my support team for sure. Like no mom could do that without the right information and support.
Exactly. And we
So
need to make clear here that we do support however you decide to feed your child. We're just here
100%.
a little bit of why it's biologically better to breastfeed. Not that is what you should be doing and what is right and what's wrong. Every single birth is different. Every single child is different. Your situation, the medication that you're taking, I mean, or the work that you have, it doesn't matter. There's so much that's involved in this. We are here really just sharing a little bit of information, but we do support however you decide to feed your child. And we welcome you into this space to ask questions. We want everybody to ask questions and be interactive. So please feel comfortable to send your questions over our way, and we'll do the best we can to answer them.
Yeah. So a little bit, just kind of some background for those that aren't familiar or whatnot. How does tongue tie affect breastfeeding? And so really it's all in the mechanics. If there is a short frenulum or too fully attached frenulum, that prevents the baby from getting a good seal and having good movement. So one of the main differences in breast and bottle feeding is bottle feeding, the nipple is already out there and baby can just kind of latch onto it, right? With breastfeeding, the tongue really has to move up and drop to pull the breast in. And it's called breastfeeding, not nipple feeding, because it really is, a good portion of the breast and it fills the baby's oral cavity. And so when a baby cannot get their tongue over the lower gum ridge, right, and support the breast on that side, what happens is the breast tissue gets between the gums and triggers a phasic biting, and that's when moms have pain. The other thing is, yeah, whew,
I feel like
the other thing is, getting that deeper latch. If you're just on the tip of the nipple, that's going to get very sore. Um, so having that lift and lower to really pull the whole breast and get that deep latch is important. Cupping, tongue cupping, so getting right. That maintains the suction on the breast, and we'll see babies that cannot maintain that. We see babies that that frenulum is really short and they're trying to maintain it, but you keep hearing that clicking sound. And when you're not getting a good seal, you swallow a lot of air. When your belly is full of air, it's got to go down or up as far as to release the pressure. And so that's where we get a lot of those reflux babies, where it may not be true reflux. It may be just related to air and babies spitting up a lot more. Other things that we see, obviously, due to the mechanics, moms having bruising, creasing, cracking. I mean, absolute trauma to the breast, and even like to the point of open wounds, infection. I had a mom years ago who it's seared in my mind. Her nipple tissue looked like ground beef and like a piece was hanging. And I think a lot of people, a lot of professionals are well meaning and they're like, well, the baby's gaining weight. Great job. But I
I
mean, that mom is on her last leg. Like, I definitely see um, feeding difficulties with breastfeeding, and moms not able to meet their goal or feel supported, or they're having to tough it out through all this pain and they know something's wrong, and that can absolutely contribute to postpartum anxiety and depression for sure.
definitely.
um, so yeah, it's really cool how lactation consultants really support mom and also baby. And so if there are any feeding therapists out there that see breastfeeding babies, really make sure that you have a good IBCLC that you collaborate with, because it is that dance. It's mom and baby, and there are factors on each side that really need to be assessed and addressed um, for optimal breastfeeding.
Definitely.
Um,
I recommend all of my friends who are pregnant, like go ahead and find yourself an IBCLC. If you want to breastfeed and if you're not, but go ahead and interview someone and go get to know them and find out how much it costs, find out how the visits are like. Go
right.
ahead and get some information about tongue ties or things that could happen, so you can be ready to watch out for, because after you have that baby and you're another, if you already have somebody's contact right there or have an appointment already set up, it is so much easier instead of now we need to find somebody, and who is it, and is it, do they have an appointment available? I mean, all of these things. So go ahead and find yourself a good IBCLC close to you when you're still pregnant, to help you after you have your baby. One question, go ahead.
I was going to say, this is like everything else in our society. Like, we take all these classes and prepare for the birth, but very few people take like a parenting class or a postpartum, have a plan for postpartum. And, especially, I think you shared that you had breast implants. Is that right? Did you say that?
Mm-hmm.
Okay, I thought you said that. Like, that's a factor with breastfeeding. And, most IBCLCs do prenatal visits so that you can get education, get preparation, start learning about hand expression or pumping, um, know what your body is doing as far as like the transitions of the milk coming in, all of those things. I just feel like our whole society is a little backwards in that. Just like we make all these plans for a wedding, but who's going to do the dishes and how are we going to settle arguments and stuff? And so the focus is on the main event, but not really a plan for after. So yes. All right.
Talk a little bit about the signs and symptoms for you to watch out on a baby. So you mentioned clicking, if the belly is extended because they're swallowing air. And then the signs on the mom, if the nipple is damaged. Is there anything else, signs or symptoms that parents should be looking out for the baby or for the mom?
Absolutely. It depends on what stage it's in, but like just inability to latch or difficulty staying latched and getting a deep latch. When I see older kids and we talk about breastfeeding history, the mom will often say, "Oh, he didn't like to breastfeed or he didn't want to latch." And that's kind of a misnomer. And I think as parents, there's a lot of emotion associated with feeding, and we kind of just blame ourselves, right? Or moms will say, I didn't produce milk, or
here's my go-to. Look who it is.
Yes.
Wow.
Yes, I love Dr. Rao. So yeah, those are all things to look out for because the baby's mechanics and latch and ability to transfer is what drives milk production. Early on, it's very hormone driven, but if you're not getting enough stimulation and milk removal, that's when things like mastitis and plug ducts and things like that can happen. Nursing blisters, so like the little calluses or blisters on the lips, and that can be because of a lip tie and that lip not flanging out. It also can be a compensatory thing. So if the tongue is not hanging on and stable and making a seal on the breast, what babies will do to stay on there and get their food, it's instinctual, is they'll use their lips and they'll, kind of curl those lips in.
Both of my kids.
Yeah, yeah.
Even would peel. Would peel come off, you would do it again. Would peel. Oh my God.
Right. It's like a callus. So yeah, that's something. Babies a lot of times they're like, oh, they have a really strong suck. And so they will dimple in their cheeks and use their jaw and use more of compression-based feeding than suction. Let's see, frequent unlatching. Gosh, there's lots of.
I do have one question before we go to the audience for questions. I mean, I have several questions. We could literally stay here all day talking about this. It's one questions. But let's say a mother is exclusively pumping and using the bottle to feed her baby. And if the baby has a tongue tie, it can also have issues with a bottle, right? Should that mom seek the help of an IBCLC? A lot of people don't realize that an IBCLC can see somebody who
Yeah, absolutely. And IBCLCs are trained in other methods of infant feeding. As far as for milk, they're trained in giving a pumping schedule and sizing pumps and you know all of those little troubleshooting things. Um, you know, I had a lactation consultant in class years ago say, "Okay, if a baby was born with webbed fingers, would we say, oh, well, I guess they're not going to be a piano player?" No, we would address the webbed fingers, right? And so I think our society often says, well, if you can't breastfeed or whatever, instead of asking why and giving that support and solution, that we just go automatically to a bottle. Babies can absolutely have issues with bottle feeding. A lot of the same things, not getting a good seal and that reflux, um, not being able to pull the milk and transfer. Um, and so extended feeding, so taking like an hour to take a bottle, um, you know, that results in not gaining proper weight and expending a lot of calories and things like that. The other thing is if your tongue doesn't move well, you have poor control of the liquid. And so that can be related to the coughing and choking, aspiration type stuff. And so, yeah, I mean, bottle may some babies can get by with a bottle, but again, it's a deviation from what is optimal. And again, yes, feed your baby and however is best for your family is up to you and your healthcare team. um but usually there's a reason that a baby is having trouble breastfeeding, or a mom and baby are having trouble. And so many times it's brushed off or not thoroughly investigated that many times I find, patients that were told they can't breastfeed or they shouldn't breastfeed or whatever because of XYZ symptoms. And then we get in there and we do a thorough assessment and our intervention, and I can get them their say they're bottle feeding, like you said. Sometimes you can get them back to breastfeeding if that's desired and a goal. So I want to encourage all the moms out there that if your goal has been nursing and you haven't come across the right professionals that may have assessed for a tongue tie and really are trained in it, um, I would absolutely go get an assessment, especially if they're having trouble bottle feeding too, because that's telling you that there's a dysfunction there, not just with the breast, but with the bottle.
Definitely. We're gonna start now going looking at some of these questions. Anne asked, how often have you seen inability to breastfeed because of the shape of mom's breast, despite having worked with several IBCLCs knowledgeable about ties?
How often? I would say pretty rare. Um, Inability it's pretty rare that we can't get them there. Um, you know, I think there is a time and a place for nipple shields. I think positioning can do a lot. Um, you know, and it's not just the mom's breast, it's also like the baby's setup too. So, I can think of a one patient I had where mom had really flat nipples. They did not evert with stimulation and with some of our tricks of the trade very well. And the baby was tongue tied and was very retrognathic.
Wow.
Like I saw it on the 20-week ultrasound. This was a friend and therapist,
Wow.
a colleague of mine. And so that was a case that was really tough to get for breastfeeding. But I would say, I think that's also like a little bit of a cop out. Well, it's just mom's nipples. Your nipples are too big. Your nipples are too tiny. Your nipples are flat. Your nipples are not stretchy. Like all the things. Nipples come in all shapes and sizes, and really I feel like it's more about the latch and the breast than the actual nipple,
Mm-hmm.
personally, because, a baby with proper oral function should be able to latch onto near anything.
We were having a conversation on Clubhouse the other day about this, and a mom said that it was her fourth baby, and in the hospital, the IBCLC or the lactation consultant, I'm not sure if she was an IBCLC, walked in the room and said, "Oh, sorry, you have inverted nipples or you have flat nipples. I'm sorry, you're not going to be able to do this." She's like, "Well, that's interesting because it's my fourth baby, and I nursed every single one of them without an issue. So don't
Right.
tell." But a lot of people, for some reason, are trained to think that if a mom's nipples are either flat or inverted, that they are not going to be able to breastfeed, and that is not true. Breast tissue will also change after you have your baby. That you can, like you said, you can really work.
And looking at like engorgement. So, you have that big rush of milk production starting, and mom's breasts are really firm and full and engorged, and that like flattens and stretches nipples. And so like there are techniques that lactation consultants are trained in, like reverse pressure softening and things like that to help um, get nipples more averted. So there's all kinds of options. Sometimes pumping a little bit before latching or hand expressing beforehand. um, there are different positions and holds for the breast and nipple as far as that goes. And so, really, I hope that a lot of this information gets into the hands of parents. And this is the good of social media, is that like, they could hear something like this on, and they can ask their lactation consultant. And if that lactation consultant seems like me, not really knowledgeable about it, then they know like, hey, I can hopefully find somebody that is.
Exactly. Go look for the information or take Autumn's course. Next question, Lael. She said, "Can you talk about the importance of feeding therapy and necessary adjunct therapy before and after tongue tie releases?"
Yeah, so I say feeding therapist with IBCLCs, we are the other dyad. We call the mom and baby the dyad. We are the other dyad. And magic really happens when um, we work together. Now, does every case need a feeding therapist and a lactation consultant? No. A lot of things a well-trained lactation consultant can absolutely do on their own. But I would say, in the cases of, you know, more syndromic patients or you know, aspiration, neurological issues, clefts, things like that, that are more medical complications in nature. And then, you know, a lot of times I get referrals from IBCLCs when they've done everything that is in their toolbox and scope of practice to do. And so that's kind of when, they pull me in. Or, it's a lot to manage a whole dyad. And so sometimes like the IBCLC is working really hard on just managing mom and mom's supply and stuff and doing some positioning and stuff. And then I'm really working on like the oral function of the baby. And so more complex cases, I do think, feeding therapy is important. Really working on coordinating, um, getting that optimal movement is only going to help things. And so, yeah, it definitely can be a good adjunct. But I would say in the case of breastfeeding, it should not be a standalone. It shouldn't be just a SLP or OT managing a breastfeeding dyad, because frankly, unless they have other training, they're not trained. So absolutely get that collaboration going.
Perfect. Very good. Michelle said, "Thank you both. Two questions. Babies born with high narrow palates because of ties. How to get a deep latch after the release while you work on bringing pellet down. I will do that one and I'll read the other one later.
I was gonna say that's a whole paragraph. All right. So yeah, you're absolutely right. The tongue is formed 5 weeks gestation. So if the tongue is not high up in the roof of the mouth, it helps guide the palatal shelves coming together. And so that is one of the reasons for a high narrow palate. Absolutely right. Getting a deep latch after release, there are so many different ways to do that. One of my favorite techniques, and there's tons of YouTube videos and how-to stuff out there. One of my favorite things is called the flipple. Basically like pointing the nipple up towards baby's nose when they do a wide open, then rolling the nipple and the breast into their mouth. That's one of my favorites. I'm also a big fan of biological nursing, so that laid back where baby and mom are tummy to tummy and baby is on top. That just being on top with that gravity helps with that deep latch. It also is helpful for moms with very strong letdown and babies that have trouble controlling, and managing that flow. So that helps as well. I mean, there's a lot of
Yes.
ways. I would also say, go ahead.
I said we'll write a book, or Autumn will write a book and let us know.
I don't know about all that, but I would also say just overall, babies with ties have a lot of tension patterns in their whole body. And so getting them stable and comfortable with nursing is really important. So I like sideline nursing as well because their whole body is kind of aligned and supported. It's also a nice break for mom, not like hunching over and, yeah. So that's a really good one too.
Good. Next question was, do you stop suck training with baby 6+ months? Does it inhibit learning more advanced feeding skills such as appropriate chew transport of a more solid bolus?
I view suck training as like, let's see, reinforcement.
I'm a therapist. You're always doing suck training also. So I don't feel like you ever stop suck training depending
Right. Yeah. So, I view it as like inhibiting not good patterns. So like chomping, sucking in the cheeks, clamping the lips, those type things. And I mean, suck training is basically oral motor for a specific purpose. And so, working on tongue cupping, working on elevation, working on, just stability and things like that. I think I'm not sure this may be what you're asking or not, but at 6 to 7 months is when we start kind of practicing with straws and cups and like moving to, they're definitely still dependent on breast milk and breastfeeding for nutrition, but we start learning those new motor patterns. I wouldn't say suck training for working on breastfeeding and bottle feeding is going to inhibit them working on chewing and feeding skills. You just have to address both. Like, yeah, you just don't want to only do suck training and then not start solids and start helping them learn those patterns. Yeah.
Perfect. Nikki said, be proactive, like we were saying earlier, so you don't have to be reactive. Get to know an IBCLC prenatally. Yes. What information sheet am I showing? This is Dr. Rouse. He put this together. I'm not going to take credit for it, but I do. Or is it? It's a mirror image. Sorry. So you guys can email him and get a copy of it. If he lets me, I'll post. But if you guys use it, please give him credit for it. Also, Mackenzie said there's a lot of feedback in the mic. Oh, I'm sorry. I don't know if it's better now. You guys let me know. I turned the volume down a little bit. Next question. Can exercises to stretch the labial and lingual frenum be enough in some cases to help get a good latch?
Yeah, I mean, so we do have a little bit of research out of Brazil on the lingual frenulum and its composition. It's mainly type 1 collagen fibers, which the study, they looked at histologically the makeup of that tissue, and it only stretches about 3% is what the research says. So, you know, can stretching hurt? I mean, if 3% helps you, go for it. Normally what I see, like doing some exercises and stretching, what that does is that allows other tissues to loosen and help compensate in the meantime. But if it's a true tie, and when I say tie, I kind of made a definition. It has to be there at birth, restrict range of motion, and affect contribute to dysfunction. And so if any of those criteria aren't met, you're not dealing with a tie. So if it's a true tie and meets those criteria and has been assessed and everything, I mean, it can minimally help, but again, it's just kind of a compensatory strategy and a band-aid.
And it might help with a good latch in the beginning, but then what about when the child starts eating?
Right.
Choking and the inability to lateralize the tongue, and then speech. And I mean, it just keeps going. It is just so much. It's just like getting ears pierced as a little girl. So much easier to do when they're little. In Brazil, they do it in the hospital before they leave.
Oh.
When they're born, nobody leaves the hospital without earrings. They might be changing things now, but to wait a little bit longer. But it's always, I mean, it's known. You do it in the hospital. The same thing with the tie. It's so much easier to do it when the baby's still small, still a newborn, than to wait. We all know how it gets more difficult to take pictures of your baby as they grow. The monthly pictures, well, guess what? It's going to get more difficult to do the tongue tie release. We are done with the questions here. Let's see if I had any more questions for you. Oh, yes, I do want you to share a little bit about your courses. When is the next date? You have 2 different courses, so would you share about them, please?
Yeah, sure. So I briefly touched on, so TOTS training, tethered oral tissue specialty training. I just did my 30th course, so that was cool. Yeah. And it's a 2-day, it's hands-on. We have multiple different disciplines in the room. I run around the country and travel for that one. It's a lot of fun, and it's kind of our flagship course. I created it, gosh, wow, now almost 6 years ago. No, is that right? Yeah. And so it's really cool, and I take you through, the background and history, the theory. I share my story, a bunch of the research that we do have out there, and then we do the E3 model of care, which is kind of, you know, we call it clinical practice because we're trying things and seeing what works and what has good outcomes with our patients. And so this is my model of care that I developed, and so it takes you through evaluation, so how to assess and identify and be aware of symptoms and what tools you can use, and then education, so educating other professionals, educating the family on ties and their impact, and what this means and how we work together to address this issue. Because if you don't have good education and people aren't on board and you don't have a team, it doesn't work. So that's really like the biggest piece that has evolved over the years is my education piece. And then execution of a treatment plan. So how does all this come together? You've done a great assessment, the family, and you have your team, they're all on board. So what next? How do you sequence? What comes first? What comes second? Red flags. What do you do if this happens? What do you do if that happens? And so that's really the E3 model of care. And yeah, it's a whole lot of fun. And it's really great when whole teams come and communities. So from that and feedback we got there, had a lot of doctors and dentists come. Like, this class was originally designed for myofunctional therapists, speech therapists, lactation consultant, the people actually working on the function of the mouth, like doing the exercises and improving feeding, improving speech, that sort of stuff. And guys, it's crazy. The doctors and dentists and the release providers just came in droves. So, which kudos to them, because I mean, that's great that they would come to a class taught by a therapist, and I think that really speaks a testament to the people out there that are doing this work that really want to collaborate. So they were coming in droves, and they were like, wow, I really understand like the reasoning behind this. And I really have a lot more respect for the myofunctional therapists and the lactation consultants and all that you guys do as far as like being the functional person. And I can educate my patients better on why this is important and XYZ. But then they were all saying like, okay, well, how do you do this surgery? And I'm over there like, well, I've done zero. I can give you some, good markers of a good release and what I'm looking for, but obviously I don't do surgical procedures. So that's when Dr. Ann Bynum, she's a pediatric dentist, released my tongue tie, released my daughter's tongue ties, and hundreds of patients of mine. We get great outcomes, and we really became. We started as colleagues and became friends over time, from collaborating and implementing this and facing different challenges. And so we're using my E3 model of care in our community, and then we created systems. So, how do we make referrals? How do you implement this into your practice? Timing of things, the forms that you use, all of that stuff. And so that's where we started Plot the Tot, is really like, okay, you've got your team, but you don't quite know how to put it all together. And the surgical piece, really how to do that surgical piece. Where do you start? Where do you stop? Who's a good candidate? Who's not? What sort of requirements should you have? Your office policies and procedures, like the nitty gritty. So it's kind of like the level 2. Once you've like got the basics and the understanding, you've been practicing a while, you have some experience, but really getting your team on the same page. So in that class, we also have a full wet lab with hands-on laser use and
Wow.
releasing ties on pig jaws. So that's a lot of fun.
Wow.
To, and even for therapists and lactation consultants and the chiropractors that come, when do they get their hands on with a laser? They can definitely talk to their patients better about it if they've actually held it in their hand, see how it reacts to the tissue. And so that class, like, highly recommend you come with your team, because it's great to hear the same thing at the same time and then really think about how it would work in your community and what you can take back. So a lot of practices bring their entire team, like their front office staff, their other colleagues and team members that they refer to. And so that we've offered it. This is our second year, and we're sold out for the year on that one. But we're meeting on Tuesday to talk about other offerings we're going to have. So those are like my 2 current live in-person courses. And then we are launching an online shorter courses. So like special topics, shorter courses. So stay tuned for that.
Keep us posted. We'll share on Airway Circle. I know everybody's really excited about it. I forgot to say something in the beginning, but if you guys are watching this live, whoever watches, if you write the word breathe, I'm going to send you guys a coupon for 10% your first order for Simply Breathe. So just type on the comments breathe, and I will make sure to send you a little coupon that Simply Breathe sent to us. Also, if you think that the information that you heard today is important for people to know, not only moms, but other professionals, please share this. Share on your personal page. Share if you're a part of a group that you think mothers or professionals would benefit from this information, please share for us. We do want to reach as many people as we can. That's why we're here. We're, taking a little bit of time of our Friday busy schedule to talk to you guys and to share this awesome stuff. So thank y'all for being here, for listening. I think we have another question.
I saw it, and it was a good one.
Let's see. Why are providers willing to release ties without making sure that moms have all these support services in place? Because they have not taken Autumn's course.
There you go. Standing ovation on that one. So I'll shed some light on why I think this is. I think, dentists, doctors, surgeons, whoever's doing the release, they're trained in that structural component. They're not as much trained as the functional component. And there's an analogy out there that just because you wear running shoes doesn't make you a runner, right? And so just because it's released doesn't mean it works. Just because you have the right anatomy doesn't mean it works. I think it's an interesting thing. I think it's partly you don't know what you don't know. Mm-hmm. And to be honest, like working with people after release that I didn't see before, and like having to do all that education and stuff on the back end, and rather than being proactive, we have to be reactive and kind of pick up the pieces. Less positive outcomes in that case, usually. I think once they form a team and they see how much better outcomes are and how much easier it is, because guess what? Now a mom is not calling the dentist saying, my baby's clicking when he's eating, or he won't latch, or, I'm worried about XYZ. Well, all the dentist can say is, well, we did the procedure well, and, there's no bleeding or infection or anything from the surgical site. Like, really, what else can they do? They're not a lactation consultant or trained in that, nor should they be doing it, and they shouldn't have to do it. Okay. I also think there is pressure. There's pressure from, as I don't mean to pick on moms, but they're a little desperate and worried about their kid, and they've heard that this could help. And so they go straight to the dentist or straight to the doctor and say, I want my baby's tongue clipped or released or whatever. And when you have a mom in your office crying and they're begging you to do this, it's hard to say no. Even though, is it more harmful to say no? Hey, you need to see a lactation consultant, get some of these supports in place for the better outcomes, or is it more harmful, to say no in the moment, or is it more harmful to do the procedure, and
never so know. I think case is a case, and you're going to get all three.
Yep, you have to balance that. So really, therapists and lactation consultants, I really encourage you to talk to your providers. Like, just because they're an MD or a DDS or whatever they are, treat them like another person. You are the expert in infant feeding. They are not. They are the expert in the anatomy and the structure. And so, share with them your outcomes, that, different strategies and different ways things have happened. I guarantee if it becomes easier for them and they see that it's helping people to have a team on board, they're going to change their practice. And so in my community, you don't get even a consult until you've seen lactation or therapy or whatever the age of the patient is. Mm-hmm. Because they're just committed to quality and the gold standard of care, which is having that functional assessment and preparing, and then having someone to support them and lean on through all the ups and downs after a procedure. So
definitely. That was a great question.
I think it's so hard. It's hard for them too. And honestly, there's a lot of stigma out there about tongue ties and release providers, that they're, they clip everything they see, or they're just doing it for the money or whatever. Release providers, if any of you guys are listening, doctors and other professionals are going to respect you so much more if you have those checks and balances in place. So if you don't just take anybody off the street, if they need to have an assessment and a referral from someone trained, now you're looking at them structurally. You have the functional documentation, so you're definitely not doing an unnecessary procedure. So yeah, I think it's also kind of a
Maybe we
cover
can
your.
also put a little bit of responsibility on the laser companies that are training these doctors. You know, they need to make sure that they're explaining how important it is to bring a whole team whenever you're doing this type of surgery.
Yeah,
So,
and I mean, yeah, there's only a handful, um, maybe not even that many of companies that really understand that and realize that. But I mean, they're really trying to sell their product.
mm,
They're
they're
in it.
good.
They're working backwards. If you show great outcomes, that's going to sell the product rather than just showcasing, oh, what can this fancy laser do?
Exactly.
And so, yeah, I mean, yes, and I think it depends on who is doing the training with those laser companies. Is
Also,
it a clinician or is it a salesperson? Yeah.
exactly. That
Yep.
all comes into play. Those are very good points, guys. Very, very good. Any last words? What do we want mothers who are thinking about breastfeeding or are concerned that maybe their baby is going to be born with a tongue tie? What is the last thing that we want them to leave this conversation with?
I think really just trust yourself and trust your gut, because when you feel like something is not quite right, knock on the doors, do the research, and ideally learn about these things beforehand. Not to freak anybody out and be worried about this unnecessarily, but it's good to have red flags to look out for. And so maybe taking the time to invest in a prenatal lactation visit or a prenatal breastfeeding class. That would be really helpful. Um, and just know there are places like the Airway Circle. My website has a directory of people that have taken training on tongue tie. There are places and directories out there like that,
Mhm.
that if you reach out to one of us, odds are we know somebody somewhere near you. Um,
Exactly.
and the other thing that I would say is just, yeah, that not all professionals are created alike. We all have differing philosophies and experience and training. And so just because you've seen one lactation consultant that says there's not a tie and it's not a problem doesn't mean that's the truth. That might be their truth and their lens, but they may not know what they don't know. Yeah.
Exactly. That is very valid. I just want to remind everybody we have on Airway Circle clubhouse meetings on Tuesdays and Thursdays at 8 p.m. Eastern Standard Time. Each day we have a different topic. Yesterday we talked about TMJ. Next week on Tuesday we're going to have Dr. Clark talking about TMD appliances. And on Thursday we have Sammy and Nick from the agency 365, which they are a marketing agency. They do websites and social media stuff only for Airway people. So if you guys are in the Airway, need any help with your social media or your website, you can reach out to them or come to our clubhouse so you can listen to the tips and tricks they're gonna be sharing with us. On Friday, our next speaker is actually one of the pioneers in the field. You guys can DM me if you want to guess who it is. I'll send you a prize. But we're very excited. Lael is the one who was able to get in contact with him. But we're also going to be talking about tongue ties. If you guys are not part of our Airway Circle group, private group on Facebook, please join us. We need as many professionals there as we can. We always share information. We're always trying to find. The main thing is connecting, patients to the right providers in their area, and we share some cool information and videos and studies. DM me. I'm not going to say who it is. DM me if you want to guess. Is this a question? The prenatal breastfeeding class I took didn't even mention ties. And when I called them for help after baby was born, they said they only provide the class and were not able to help me outside of the class.
Yeah, and I mean, that sounds probably as, what I don't want to say, but it sounds more like a very like just basic class with the hospital system. And you'll find that because it takes a lot of extra training and expertise to navigate the topic of tongue tie and the assessment and all the support that goes into it, you will find that more often than not, it's a private practice IBCLC that is really trained in that. I wish, I wish that wasn't the case. But yeah, and really a prenatal breastfeeding visit, like one-on-one with your specific history and factors and goals in mind, is very different than sitting in a group class that is just like an overview. Um, yeah, yeah. Anyway, but
Well,
knowing what the symptoms are of ties, and I'm sure at this breastfeeding class they may have told you like, hey, if you have any of these symptoms, you need to see a lactation consultant. Knowing which symptoms are correlated with ties is where it's kind of key. So
mm,
I'm sorry that happened. I hate that. Yeah, I wish we could get something more streamlined out there.
I know. Well, guys, we're going to leave you guys with this message. Autumn's class is amazing. I'm so glad I took it. It gave me the tools and confidence to help others. I am going to post the link to Autumn's courses on Airway Circle group. If you guys want to learn more about it, the link is going to be there. Autumn,
Thanks.
thank you so much for being here, for taking the time out of your Friday and sharing all this awesome information with us. You're so
Thanks.
valuable and so sweet, and we're very, very happy that you're able to do this for us. So thank you so much.
Thank you so much. And yeah, I hope you guys have a great weekend and yeah, keep making a difference here.
Awesome. Thank you guys so much. Bye bye.